Anxiety and depression, 14 to 18 years. Should a teenager fall pregnant? To prevent complications and get support from the parents, how should parents approach this? No parent wants their child to be part of the statistic, but life happens. Rather be a supportive parent than risk losing both child and grandchild to abortions in unestablished clinics. When a pregnancy is there, the teenager needs support from both parents and not scolding. Fathers cannot blame mothers and vice versa. The support goes a long way in making sure that the teenager has a successful and safe pregnancy journey. Teenagers who feel rejected when pregnant may end up committing suicide or even procuring abortions that are not medically safe. How do parents help their children with individual identity? A girl needs the love of a father to know unconditional love from a male, while a boy needs his mother to see unconditional love from a female. These relationships result in the child having correct identity and self-confidence. Children who are confident of themselves have no identity crisis. In the case of absent fathers or mothers, let someone step in and step up to take that role, as this determines how these children develop and perform at school and in the world. It has been shown that some young girls who end up in intimate relationships with men much older than them have lacked the love of a father in their childhood, and the same applies to boys. Acne issues that affect self-esteem due to hormonal changes. How can parents assist their kids? This is every teenager's problem, both boys and girls. Correct advice from a dermatologist must be sought. The main cause of acne is due to the teenage hormonal changes. How do we prevent them from getting HIV, STIs, and STDs? Teenagers must remember that the annual anonymous HIV and screening at tertiary institutions has consistently shown that at least 60% of students at tertiary institutions are HIV positive. So 6 out of 10 boys who propose a young girl are possibly HIV positive, and the same applies to the girls. And these people do not have a mark on the forehead saying HIV positive, etc. It is therefore important to teach abstinence first, followed by the universal precaution against HIV and other STIs. The use of a double Dutch method, where the female uses contraceptive and a condom simultaneously. Detailed education about STIs and HIV and their consequences to both boys and girls must be offered. The most important consequence of STIs is infertility and cervical cancer. Girls bullying each other due to different stages of development of the bodies. How can this be tackled? Bullies are generally seeking identity and lack self-confidence themselves. They are seeking attention. Teach your children and help them to be confident of themselves and to stand their ground. Confident children are a threat to bullies. Counselors must dig deep into the past upbringing of the bullies and attend to the inferiorities that are troubling them. What advice do we give parents on raising teen daughters with so many physical and psychological issues? Let the parents be the best friends to their children. In that way, a child will not look for affirmation outside the household. They will tackle problems together. It'll be easy for children to open up to them, and problems are sorted out much quicker. Money does not bring up a child. All children want a present parent, regardless of whether the parents are together or not. The child needs both, not their money. A child who is close to you will tell you everything. Parenting is by all people, and a child needs to know that every adult is their parent.